In this short video, I'm going to talk to you about homosexual OCD, or the more recent title, which I personally prefer, sexual orientation OCD. This is where you are having unwanted, we call them intrusive thoughts, that's making you think that your sexual preference has changed. Throughout this video, I'm going to be using the example of a heterosexual male who is having intrusive thoughts that his sexual preference is changing and that he is now attracted to men. But let me be very clear at the outset, when I'm talking about, or indeed when anybody is talking about homosexual OCD or sexual orientation OCD, we are talking about OCD. You might be surprised to learn that this manifestation of OCD has nothing whatsoever to do with your sexuality or sexual preference, and like all forms of OCD, can be experienced by all members of the population. Sexual orientation OCD can be experienced by anyone, whether you're heterosexual, whether you're a gay man, whether you're a lesbian woman, whether you're bisexual, it doesn't matter. Remember, this is OCD. It's not actually about your sexual preference, it's an intrusive thought pertaining to OCD. But it can be very problematic if, for example, you've been in a long term committed relationship and find yourself wondering, should you walk away? And it's all down to these confusing thoughts that you have in your head. You might find yourself struggling with these thoughts and wondering, should you be with your partner at all? Your sexual preference seems to be changing. If you are experiencing this form of OCD, your sexual preference won't be changing. What will be happening to you is that you're having intrusive thoughts, obsessive thoughts regarding your sexuality. And like all forms of OCD, these thoughts feel real and they cause an extreme amount of distress. I think the best way for me to continue this small explainer video is to describe some things that I've come across in my own clinical practice. I'm going to talk to you about a real person that I saw in my private practice. Now, you won't be able to identify the person in any way, but it's a good example for the point of this video. This was a young guy that came to see me for therapy, been heterosexual all his life, but for the past few months, had started to believe that he was attracted to men and was considering leaving his long term girlfriend at the time, as he didn't know what to do. In session, my client was able to tell me that he was starting to become worried that he was gay. He was clearly struggling. As he says, he'd been in a long term relationship with his girlfriend for many years, and it was a very happy relationship. But he couldn't shake the thought that he might be gay. He said that he was noticing other guys on the street, whether they were attractive or not, and was beginning to see this as some sort of evidence that, yeah, he must be gay and never knew it. So he started to look at men on purpose to see if he felt any form of attraction. He said he even started watching gay porn as he noticed he was starting to set up all these little experiments to see if he felt anything, because he just wanted to know for sure whether he should be with men or with women. I asked him, did he want to be with other men? And he told me that he would have no problem being with other men. He would have no problem if it turned out he was gay. I told him that there's a difference. I'm not asking if you have a problem with homosexuality. I'm asking, would you want to live your life with another man? He told me that he wanted to be with his girlfriend. They were considering getting married. That was up until all of these thoughts started popping into his head, and then he started questioning what was happening to himself. As I explained to my client, there is a huge difference in having intrusive thoughts that, for example, you might be gay, and for those individuals that are wanting to come out. A man that is considering telling his friends and family for the first time that he's attracted to other men or possibly in a committed relationship already with another man doesn't have to set up little experiments to test out his sexuality. He knows for sure that he's attracted to other guys. And he's very clear in his mind that it's men that he wants to be with. These are not intrusive thoughts. He knows that he wants a committed relationship with a man. Let me be very clear in case you're confused in any way. If you're experiencing sexual orientation OCD, homosexual OCD, it has nothing to do with coming out. If someone is considering coming out, they actively choose to think about their sexuality, knowing that they are attracted to members of the same sex and want to think about how to live their life authentically as a gay man or a lesbian woman. There's no doubt whatsoever in their mind, and doubt is very important in terms of homosexual OCD. OCD is characterized by doubt. If you're experiencing homosexual OCD, sexual orientation OCD, you are plagued with doubt and you obsess over it. And you carry out all these little experiments to check and see if your sexuality has changed or not. These are called compulsions. And it's all those unwanted thoughts in your head, questioning your sexuality, all the doubts that you have that you obsess about, that contribute to you carrying out all those little experiments to check out if your sexuality has changed, all those compulsions that highlight the fact that the obsessions and compulsions that you are experiencing are, in fact, obsessive compulsive disorder in relation to your sexuality.